Hi, good afternoon, everybody. This is Cheryl Arno, the Executive Director of the Down Syndrome Association of Atlanta. And we were going to have a speaker tonight, but due to low registration, we decided to do it in this format instead. So now we will be sending it out to everybody because Howie Rosenberg from Gigi's Playhouse and I feel so strongly that it's really important to keep y'all up to date with everything going on. My friend Charlie Miller is here today from the Georgia Council on Developmental Disabilities. He's been with us before and he has a lot to say. So we're going to go ahead and get started. And we will be sending this out to all of you very shortly. Charlie, thank you so much for coming. We really appreciate it. And we certainly appreciate all of your insight and certainly all the work that you were able to do down at the Capitol this year. It was actually, I think, what people would call a very successful year. And I know that you had a lot to do with it. So we are so appreciative that you're here today. So let's go ahead and get started.
Yes, no, thank you so much for having me, Cheryl. Hi, folks. My name is Charlie Miller with the Georgia Council on Developmental Disabilities. I am so excited to be here with y'all today and to be able to talk to y'all about updates from the legislative session. So, like I said, my name is Charlie Miller. I am the legislative liaison. I'm sorry, legislative advocacy director here at the Georgia Council on Developmental Disabilities. So the legislative session takes place every single year from January to about the end of March, beginning of April-ish. During that time, all the state legislators, so your state house members and your state senators, go to the Georgia's Gold Dome in Atlanta and talk about future laws that they want to pass and put into work in Georgia. This legislative session was a very good legislative session, and we were able to get some really cool and good things for our disability community in Georgia. Every single year, we do a survey that gets sent out, usually in late spring, early fall, around what folks want to see us advocate around. This
So
year,
Charlie, I want to just interrupt real quick. How do
yeah,
people get on that list? How do people get your updates?
yes. So for the survey, I believe you're on the survey list, Cheryl, and you should be able to get it.
Okay.
But if someone's not on the list, all they have to do is go on to the Georgia Council on Developmental Disabilities website and sign up for our newsletter. Once you sign up for there, you'll be able to get all the information sent to you throughout the year.
Perfect. That's what they need.
Yes,
Sorry.
no, it's very useful, and we really want to hear from our community because we don't want to be the ones making the final decisions about what we advocate for. We want to hear from our community and making sure their voices are heard at the Georgia Capitol. So we will be going through some of our legislative wins from this year, and really kind of focusing on three legislative bills, and then from there we will go on to the federal work that is happening currently in DC. So for federal wins, our first one is ending 14C, Senate Bill
Well, not
55.
federal, state,
What? Yes.
our state one.
Sorry, it's been a long day already. So our state session, the state bill, Senate Bill 55, ending 14C. This bill will end shelter workshops in the state of Georgia over a 2 year period. This bill, it will, I want to kind of go through and make sure we're all on the same page about this. This does not affect your mom and pop shops, your grocery store, your Chick-fil-A, your Walmart, or any of those organizations. There are only 12 organizations, and it's actually gone down even more than that since this bill has been passed, that currently still do this in Georgia. These places are very segregated and not in our communities, and all we're saying is you can still have the shelter work, you can still have the workshop there. You just have to pay people with disabilities at a minimum wage in Georgia. That's all we're asking. We're not having anyone shut down or anyone completely close a a a place that they go to work. We're simply saying we want to make sure that people with disabilities are being paid at a minimum wage in Georgia, and there are several organizations in the state that actually help these organizations transform. So where they're able to get an understanding of they don't have to close anything down. They just need to make some minor changes to make sure people are being paid at a minimum wage. The
And
next
what it
bill.
comes down to, Charlie, is
Mm-hmm.
and what I've spoken to colleagues about is that our folks deserve to be valued.
Mm-hmm.
And if they're getting paid 22 cents on the dollar, and I know that people talk about that they just want a paycheck, but now that we know better, we need to do better. And we know better than to do that. And people deserve to be valued and at least get minimum wage.
Yeah, yeah, and there's so much opportunity for people with disabilities to be able to make at a minimum wage and not lose any type of benefits.
Right.
So
That's the
we're
other
really
big thing.
excited about this. Yeah. The
And I want to
next.
add that I got to go down and see it signed, and that was a great thrill for me, because I've actually never watched a bill go all the way through. So to watch it get signed was one of the thrills of my career. But I also want to point out we're only the 17th state in the country, I think, Charlie, is that right? That has
Mm-hmm.
passed this. We've been working through the National Down Syndrome Society to pass this for years. And I'm very proud of Georgia and all the work that y'all did down there to make sure that this happened.
Mm-hmm. Yes, it really takes a village for us to advocate together. So I was really excited about getting that bill done. Another bill that we were excited to see was Senate Bill 233. This bill increases the Behavioral Health Commission that has already been established in Georgia, from 24 members to a 30 members. And they're including a intellectual and developmental disability provider, a leader of an intellectual and disability advocacy group, and a parent of a person with the intellectual disability. We're wanting to make sure people with disabilities are getting the right behavioral health care as well. And this will be a step in the right direction for us. So we're really excited about this. And then last but definitely not least, uh, um, House Bill 123, the intellectual disabilities and the death penalty. So this bill, in Georgia, we had one of the strictest, what they call burdens of proof to show that a person has intellectual disabilities via the Supreme Court by many years ago. They have said that people with an intellectual disability do not qualify for the death penalty, but they do qualify for life in prison if that is what is needed. This bill completely follows the law within the federal work to down in Georgia, and this bill changes the burden of proof to be in line with all the other states, so that Georgia is no longer executing people executes people with intellectual disabilities. Now,
That was a really
all
big one,
three.
Charlie. I can't believe that y'all were able to get that through. That was a big surprise to me, and one that I'm very proud of. What people also don't realize is that we were the last state in the country to do this. I think that that was important to the story too. But um, people also would ask me and say, "Well, they haven't executed anybody in a long time with a developmental disability," and I was like, "Not since March of this last year." So it's been a long time coming, and I know y'all worked really hard on that.
Yes,
And now you get to see it.
yes, all three of these bills have been something that have been worked on for many, many years. And I'm excited to see a lot of these things get passed.
Not just ask one more thing, Charlie, or jump in,
Hmm.
is how many waiver slots did we get this year?
150.
Okay.
Yeah, only 150. And we have a waiting list of, oh, someone told me the other day, 7,890, I believe, are currently waiting for the waiver in Georgia.
So, and what they're also saying, though, which I think is really, I mean, it's an interesting tactic, is that they're saying that those 7,800 and change numbers don't, that that's not a true number. And advocates say that it's actually more, but other people say that it's that there are a lot of people on that list that's that much that don't qualify. Do you hear that? That they're too young
Yes,
to really be on it.
yes, I do hear that a lot. And I think it's a both and situation. I think that people do get on it extremely early, trying to be prepared and be ready for the next step after they get done with the school supports that are in place, and also the K. Beckett waiver. I will say it is very hard for us to get on the waiver in Georgia. And that means that a lot of people with disabilities aren't able to qualify to get on the waiver in Georgia. And that's an issue that we definitely have in Georgia. And I think that we will have some good movement within the next couple years to make sure that that gets taken care of. I'm hoping at least. So, all right. So all three of these legislative bills, have officially been signed into law. Actually, yesterday was the last day for the for for bills to be what they call vetoed, which means taken out. So all three of these bills have been signed into law. So now we've talked about our state issues, and I love my state, but now, y'all, we gotta talk about the federal stuff. We have some major federal things going on. So, as we've talked about in the past around Medicaid, Medicaid is one of the biggest things that our community depends on, and it covers the waiver system in Georgia. This is not just the now and comp waiver or waivers for people for older people with disabilities. This is also the Katie Beckett waiver as well. Currently in the federal system in DC, the Congress is deciding how much money the federal government spends on programs like the Medicaid program. They have told us that that there is going to be $880 billion in budget cuts over the year over the next couple years. This is a huge concern for our community because that would make a huge piece of Medicaid getting cut in Georgia. Late Sunday night, the House Energy and Commerce Committee released their latest and most detailed plan for how they want to make those cuts. And there'll be more details on the next slide about this, but it says something that they released this overnight in the middle of the night, trying to get this done as quick as possible. Before this bill can come into become a law, the committee has to vote on it first, and if they approve it, in which they did, it will go to the House and then to the Senate, which it will also need a vote. So the most recent version of this bill, which was released just a couple days ago, includes a lot of the following: major funding restrictions, at least $715 billion in cuts in Medicaid over a 10-year period. And that would be a huge coverage loss for 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 Georgia. The Independent and Nonpartisan Congressional Budget Office uh, uh, predicts that this will cut over 13.7 million Americans. And Medicaid programs changes include adding a work requirement for able-bodied adults without dependents. So, and then also it will one of the other things that it will do, it will delay minimum nursing facility staffing standards until 2035. So currently, it is in federal law that a person with disability or a person in a nursing home has to be checked on um uh um uh very often. And if this bill gets passed around the Medicaid funding, it would say they only have to be checked on every 24 hours. This will also say freezes provider rate taxes. This will be a significant source of state funds for Medicaid, and this will directly affect home and community-based services like the Katie Beckett waiver and the Now and Comp waiver. So this is a very concerning thing for Georgia's disability community, and this will be affecting almost every single person that either has a waiver or is on a Medicaid program in Georgia.
So Charlie, can I just again I want to clarify. So the Katie Beckett waiver, which now is actually hard enough to get as it is, um, so if people already have it, they will get cut from it, or new people trying to get it would not be able to get it? Isn't it both?
Yes, so it would be a both situation. And we're trying to get exactly how much this will affect our communities directly. I will say home and community-based services like Katie Beckett and the Now and Comp waiver are what are called optional waiver programs. So technically Georgia does not have to isn't mandated to do this programs. Um, and, and this is meaning if Medicaid is being cut and they're trying to find some free space to not have the cuts be totally detrimental, the home and community based services will be one of the first things that get cut in Georgia.
So those are federal things that we will feel all the way down here, correct?
Yes.
So, okay. So clearly in our community, it's the Katie Beckett is top of mind and the Medicaid waiver. So
Yeah.
again, so would they potentially could this potentially affect future Now and Comp waivers? Or will this
Yes.
affect people that have them currently? Could they be cut? Because most of the individuals that I work with just got big raises for their Medicaid waivers. And so potentially still their stuff will be cut.
And we're honestly still trying to figure out exactly how that would look within the state. We don't have all the answers right now. Within how this cut would look within the state. The state uh organizations have not released guidance on that yet.
Okay. So, but it still comes down to our legislature has to decide on this. So the federal government sends it down, but is that why Governor Kemp can say 1 year 100 people or 150 people, and that's why we have the control of how many people get it?
Yeah, so it's a yes and no situation. So the if the governor said, I want to invest, 500 waivers, that money could be drawn down from federal government
Got it.
because the state is providing that match.
Got it. So the state
But
has to decide whether to have that match.
yes, but one, they can decide if they have that match, but also the federal government is now saying, even if you give me 500, enough for 500 waivers, so like 6 or 7 million dollars, that money's gonna go less far, and you're gonna get less waivers than what you previously were able to get.
Mm.
But I will say, we don't want to say that this is a end all be all. It is not set in stone yet. This bill was supposed to be released in January, y'all. And as far as my calendar shows me, we're in May, y'all. So because of advocacy from people like y'all calling your congressmen, men and women, and making sure they understand these issues, they expected to make they were expected to make these changes, and a lot of the most concerning things did not even make it into this bill. It took them 90 days for them to just get this out. So our advocacy is important here. And this is not the final version of the bill. It has to go through many more votes from now until it gets final passage in the Senate. That being said, changes can still be made. However, the House is hoping to get this bill passed out by May 26th, Memorial Day.
Of
That
this year.
say again?
Of this year.
Yes. They're trying to get it out of the House this year. And when it's in the House, this is the time for us to be advocating, because we have a lot of House members. Georgia has many House members, but no matter what, each state only has 2 senators. So the time to advocate to the House is now. So we're really wanting to make sure people are reaching out to the legislator as much as possible. So right now, we are monitoring the developments in Medicaid policy and budget proposals. We are hoping to stay on top of everything, and we will make sure to get information out as soon as possible. We're asking advocates to contact your congresspeople to express the concerns about the Medicaid cuts. Share any personal stories illustrating the importance of Medicaid and DD services in the state of Georgia. And y'all, it takes a village to raise a child. Well, it takes a village to save Medicaid. Encourage others to reach out to their House members and offer to be a resource for information on how Medicaid impacts your district.
So along the community line, I want to make sure that everybody recognizes that a lot of our national partners are actually partnering together. So that's the Global Foundation, that's the National Down Syndrome Congress, and the National Down Syndrome Society. And so, I can give a shout out to Kim Knight and her family who just went up to DC to discuss this with John Ossoff and Raphael Warnock. NDSS had a wonderful walk on Washington. And NDSS and NDSC in particular are sending out updates fairly often about what's going on federally and how to make sure that you're involved. But our Down syndrome community is actually a very small community. We're small, but we're mighty. So I would encourage everybody to sign up for GCDD's newsletter. I know that I watch it. Charlie has lots of webinars. We're hoping to do more training this year for people that are going to be going down to the Capitol. We had over 100 people show up at the Capitol on March 21st, and we were really excited about that. But Georgia Council usually has 3 advocacy days, and it's really important that our community is seen down at the Capitol. And I don't just mean from the metro area, but we have Athens and McDonough and hopefully Savannah and Valdosta to show that we're all. This affects everybody. We can't be more clear. This affects everybody, and especially when you talk about Katie Beckett and the now comp waiver. I don't know what a lot of our families will do if that goes away. So please make sure whatever group you're going through or advocating through, whether it's DSAA or any of the others, please make sure that you're kept up on what's going on and make those calls. They do count those calls. And I want to encourage everybody, if they have questions, they can certainly reach out to me. And I know that we'll have Charlie back, as a lot of this stuff is literally happening as we're sitting here speaking. And we have till May 26th. So I want to make sure that everybody gets heard, because otherwise our community ends up really small. And we need a lot of support as well. So Charlie, what else do you want to make sure that we know that we may not have heard?
Honestly, right now, call your house member. Right now is the time to call your house member and make sure they understand what Medicaid cuts will mean for Georgia and you personally. One thing that they're doing right now, they're getting ready to vote on this bill. This bill will be detrimental to a lot of people with disabilities. And we need to be coming together and advocating together on why this issue is important to us.
Because if we don't say it, then they just assume that everything's okay. That I can tell you
Exactly.
is that they are very happy to make assumptions. And it's not a Republican thing and a Democrat thing that we all have to stick together. We all need everybody. And
Hmm.
I think that getting out of that box is also very important. Um, and and your story is really important. The stories that our families tell. Quite often, and Charlie and I have this discussion all the time. I don't have a child with an intellectual disability. So quite often, if I make those calls, they think of it as me saving my job, which hopefully if people know me well enough, they know that not to be true. But they want to hear from parents. It's really important that they hear from moms and dads in particular. And if you
Hmm.
have a self advocate sitting in your house, please make sure, because they get a vote too. We fought really hard to make sure that they get votes. So if ever there was a time, it's now. And I have a sign in my office that says, if you're waiting for a sign, this is it. And it's it. This is time. And so, Charlie, if I can, I'm going to ask that we do this again in a few weeks. And we can even do it this way, or we can get back on the calls. But we understand that today everybody's probably really busy with the end of school and graduation and everything else. But we wanted to make sure we got the information to the people that we needed to get it to. And that's the people that we serve through DSAA and GG's. So, is there anything else you want us to know, Charlie?
No, I think you hit the nail on the head. I look forward to being back soon.
Thank you so much. And with that, y'all have a good night.